Professor Parvizi, we are so glad to have you here with us and welcome to Egypt. It's a great honor.
Thank you so much, Dina. I appreciate it.
Many viewers know your name but may not grasp your contributions. Can you briefly introduce yourself and explain why you are very well known worldwide?
Yeah, thank you. I'm a professor of orthopedic surgery at Egiebadem University. Briefly, I did my medical training in England, did residency at Mayo Clinic, then did a fellowship in Switzerland, and then I worked in Philadelphia in a very important organization called Rothman Institute for 20 years. Now I'm at Egiebadem University. I've done huge amount of research and very large volume of cases. My research is related to infection, venous thromboembolism, and basically improving patient outcomes. Because of that, I guess people have read my papers and they might know my name.
Your career includes more than 10,000 joint replacements, over than 2,000 joint preserving procedures, and you publish more than 1,000 papers. How can you balance between research and busy surgery procedure? What a typical day look like for you?
Oh, thank you. I was lucky to be in an organization where you could do a very large volume of cases very efficiently in a day and still have some part of the day left for you to go and do research. I was also very fortunate to be surrounded by a lot of brilliant men and women who came to work with us, including some Egyptian doctors. They also contributed towards my research and our academic scholarly work. So I've been fortunate to be surrounded by people that have helped me to get to where I have gotten to.
That's not easy at all. I think it needs a lot of effort and a lot of time management.
Yeah, I think as I tell my kids, I am doing a job that I love. So for me to wake up early in the morning, go to the operating room, do cases, to work late at night, to edit and write papers, do research, all of that felt like real hobby and joy as opposed to work. So when you have passion for something, I think you work very hard without knowing that you're working very hard.
That's a great advice for the new generations.
Yeah, the passion is really very, very important.
Very few surgeons match your surgery volume and research output. What is the most important for orthopedic surgeons nowadays? Is it teaching or innovating or operating?
Yeah, a great question, Dina. I think all of the above, but some people don't have interest in research. That's okay, as long as they take great care of patients. You have to remember, we're doctors first. Our job is to take care of patients and put those patients ahead of everything. But if you do research and innovate, you can also improve patient care and improve on the status quo. If we didn't innovate and we didn't do research, we would be doing things that were happening 100 years ago. But as you know, the modern medicine has changed thanks to research and innovation.
So the three are important, right?
Absolutely, it's very important. And if those doctors who don't want to do research, then other people have to engage in research and innovation. Very important.
The Royal College of Surgeons in Ireland awarded you this month their highest honor, the honorary fellowship. First of all, congratulations. We are so proud of you.
Thank you.
And what does this mean to you and your career?
It's a huge honor because it obviously it's rare that a surgeon or a clinician would get these type of honors in their lifetime. I am incredibly grateful to the Royal College of Surgeons of Ireland for bestowing me this amazing award. It means the fact that my work and my engagement in research and innovation in training Irish surgeons was recognized, and this honor I will cherish for the rest of my life.
Well deserved, Professor.
Thank you so much.
We are here beside the pyramids of Giza, the symbols of one of the world's earliest medical civilizations. As you know, the ancient Egyptian already treated fractures, dislocations, and joint problems. How do these ancient practices connect with modern orthopedics?
Actually, very, very similar, believe it or not. In concept, we're still doing what Egyptian doctors were doing in the old days. And as you said, I visited the Valley of Kings, for example, Luxor, and seen some of those scenes of medical delivery of care. They were brilliant, simply brilliant. And even though we have technologies today, the essence of modern medicine is still founded in the old principles that the Egyptians and other empires have taught us.
That's incredible.
It is incredible. I agree. It's amazing.
If you had the chance to speak with one of the ancient Egyptian physician who treated fractures with wooden splints and herbal resins. What modern orthopedic principle or technology you're going to show him and why?
Well, we could tell them that we have better ways of doing the surgical procedures now under better anesthesia technique, analgesics, and the patients don't feel as much of the pain in the old days. But I would also ask them to teach me about the ancient medicine in terms of prevention of infection. We may come to that. You know, an area of my interest is infection prevention and treatment. And believe it or not, the ancient physicians and scholars knew how to do a great job of preventing infection in those cases when they operated on patients without having all the modern technologies available to them. For example, like use of honey in Egypt, in the old Egypt. Now we're coming to realize that honey has a lot of antibacterial properties. Yeah. Vinegar, the use of vinegar in the old days to clean a wound or cleanse a wound. Now we're coming to recognize that natural products have some antibacterial properties. So it's amazing how brilliant they were and how far ahead of their time they were. And now the modern medicine is reflecting back on that ancient medicine and learning from them. So I might tell them a few things that we're doing differently today, but I would also love to hear from them as to how we could be doing things better.
You want to know more secrets, huh?
Yes, more secrets of them, exactly.
Hip and knee problems are rising worldwide due to aging and lifestyle. What are the biggest orthopedic challenges for patients today?
Yes, they are. We're doing more and more replacements, partly because the operation is so successful. Hip and knee replacement is amazing, particularly hip replacement is incredible. So in the old days when people were crippled, they couldn't walk, they were bound to a chair, and they were having a very, very bad function with arthritis. Now they don't have to suffer. But because of the rise in the incidence of obesity, diabetes, people living longer, and arthritis in itself increasing, we're seeing more and more patients that need hip and knee replacement. So the challenge is the volume, one, that all the healthcare systems have to pay for these new operations, but also infection is our biggest enemy at the moment. Yeah. So I fear infection when I'm going to the operating room. I think patients now fear infection. If an infection happens after a knee and hip replacement, is bad as cancer. It's like telling patients that you've now developed cancer. So because of that, we have to do everything possible to try to minimize infection.
You are known globally for your work in preventing and treating prosthetic joint infection. That's what we were talking about the previous question. What recent innovations have improved outcomes for patients requiring revision surgery?
Yeah, at Agiebadem, we have a very strict protocol for managing patients. I was in Kuwait yesterday. We did a case in Kuwait. Some of the infrastructure that we have in Agiebadem is not available elsewhere in the world.
Okay.
For example, we are able to do molecular techniques for isolating DNA of organisms. We have the new sterile antiseptic solutions available. We have different surgical protocols in place. So these are very, very important in one, preventing infection in the first place, but treating infection and getting a better outcome. So we have spent a lot of time in a multidisciplinary form to implement protocols at Agiebadem in Istanbul that, in my opinion, gives patients the best chance of getting cure for an infected joint.
I think this is why the IGC Center at Agiebadem Maslak Hospital is unique and different from other orthopedic centers.
Yeah, and that's why I left Philadelphia after 20 years of practicing there to come and build the IJC in Istanbul. It's a perfect place to build it. We have the multidisciplinary team available. We have the resources. And I agree with you, IJC is the place where I would have my replacement. But of course, I'm biased.
In many countries, revision surgery is a struggle due to missing implant parts or labs. How does your center handle these cases?
We have, as they say in surgery, you have to have a plan A, plan B, and probably a plan C. That means if an implant didn't fit, you have to have the alternative implant to go to as a plan B. In Egypt, I know some implants are not available. So I've had patients from Egypt sent to me by Egyptian surgeons to come and have their surgery done at IJC in Istanbul, where we had those implants available. At IJC, we have A, B, C, and sometimes even D available, just in case things change during the procedure.
Talking about patient traveling to Turkey indicates, you know, that Middle East and National Africa patients used to travel to USA and Europe for complex care. How does Turkey and IGC Center in particular offer a high quality, accessible alternative?
Yeah, look, I practiced in US for 20 odd years. I will tell you that unfortunately, because of some changes, there is a decline in quality of care in US. There is decline in quality of care in Europe. I was frustrated with all of that, and that's why I left US to go to Istanbul.
After all of these years.
Look, it's one of the most beautiful cities in the world. It's an incredibly sophisticated healthcare system. And I would myself have my surgery done in Istanbul, then go back to the US. And in fact, for that matter, we just operated on a very famous Hollywood director who came to Istanbul all the way from United States to have his hip replacement done.
Okay.
So if these people are coming to US, and we're seeing more and more of these people, it is the place, in my opinion, for modern care. You don't have to travel these long distances to Europe and US. You don't have to deal with the visa issues. You don't have to deal with the social political situation. And you don't have to deal with the substandard healthcare in some of those European and US facilities. Come to the best place. IJC is the place to provide you with the ultimate care that will prevent complication and give you the best outcome.
If I'm a patient and I want to reach your center, how can I go there and how can they help me to go to Turkey?
Yeah, you can. If you need joint replacement, you can do International Joint Center. We have a website. Yeah, Egibadim also has a website. But if your problem is non-orthopedics, just go to the website Egibadim. There are numbers there, and you should be able to access them. If not, I'm on Instagram. Reach out to me, and I'll be happy to help you in any way I can.
You lead the International Joint Center at اجيبادم Maslak Hospital. What makes the IGC different from other top orthopedic centers worldwide? What advanced technology do you use for safer, more precise joint replacements?
Great question, Dina. Two things. Number one, we do only evidence-based protocols. We do things that the science and research has shown that is the best for the patients. And sometimes that means spending money to have those technologies available. Because of our fantastic leader, Mehmet Ali Bey Aydınlar, who runs the Egibadim Healthcare, we're not restricted or limited by resources. If I need to buy a robot, I can buy a robot. If I need to have an expensive dressing to prevent an infection, I can have that. If I need to have sophisticated instruments or implants in the operating room, I have access to them. So the fact that you have the evidence-based protocol plus unlimited resources to help you help the patients, it makes IJC a true heaven for me to practice it.
The IGC receives patients from around the world. How does your multidisciplinary approach and follow-up system ensure safe recovery after patients go back to their home countries?
Fantastic question. It starts actually before they travel to Turkey. Through WhatsApp or other means, I do virtual consult. I look at their x-rays, I get their reports from their doctors, and tell them whether we can or cannot help them. I don't want patients to travel all the way to Istanbul for us to turn around to them and tell them we are not offering you an operation. So those who arrive in Istanbul, majority of the time need an operation because we've already seen their records. We have evaluated them virtually. When they come, we do the surgery. I'm spending 3 weeks of the month in Istanbul. I'm around. We have a multidisciplinary team that's around. And interestingly, when they leave, I ask them to give me a report on WhatsApp on a daily basis with pictures of their wound, with their gait, with how they walk, etc. So all of that, we're involved. And sometimes this needs to go on for 3 months. Sometimes every week is enough. So follow-up is much, much better than they would get if they were to go to Europe or United States.
Finally, with AI and advanced prosthetic on the rise, what's your vision for the future of the joint replacement? What challenges will next generation of orthopedic surgeons face?
AI is going to change the face of medicine like it has changed the face of modern society. We already are seeing AI influence us immensely. We actually use AI for diagnosing infection, for preventing infection, and in many other areas at IJC. We have AI experts that help us to implement AI to improve patient care. In terms of joint replacement, it will, one, tell us which patients are not going to benefit from joint replacement, and they are better served by other procedures like joint preservation. It will tell us what protocols we need to have in place to try to minimize risk of any complications like bone breaking after replacement or getting infected like we talked about, and many others. And more importantly, AI will tell us in terms of what type of medications we need to give to our patients in the post-operative period to give them the best pain relief.
Professor, we are so glad to have you here with us. It's such a great honor. It was a really beneficial interview, and I would like to see you again, and welcome to Egypt.
Thank you so much, Dina. It was a pleasure for me to be here.
Thank you so much.
Thank you.